Welcome everybody who decided to join us. I'm Catherine, just from Microbalance. Just going to be sort of the moderator here. When we get into mold, I can answer some of the probably product questions, but I am not a doctor or a practitioner, so I am not the body person. I am more the microbalance product person. And Dr. Sue is the body person, and she's a naturopathic doctor, licensed in both Connecticut and New York.
California.
Well, California, and she sees patients in person in New York like once or twice a year.
Yeah,
Okay.
recently it's been a bit more than that. They unfortunately don't license naturopathic doctors in New York. Otherwise, I'd have a license there. But for now, we can still help people as much as we can. And I do that with a lot of my patients. I actually see one from New York from right now. Okay.
Hi. Well, and so today we're going to talk about a topic that you see a lot in your practice, which is burnout and what's kind of called adrenal fatigue. So I'll let you kind of take over and start and let us know if you want to like go down any other different paths than what
Yeah, of
I've
course.
kind of got mapped out. But I thought we could just kind of start with you talking about what it is,
Mhm.
and how you sort of identify it with your patients.
Yeah, absolutely. And I want to thank you for answering all of my mold questions for my patients because you guys have been, you and Nicole, I've been swapping you too in my head, have been so helpful. So whenever I have patients, you guys, I always am sending test kits to you guys, asking questions. When they come up potentially normal, I'm like, okay, what else do we do? You guys give me tips for them, and then we end up finding things. So I can't tell you how helpful you guys have been to help me help patients. So thank you so much for being always available. You guys have been incredible.
Well, I
So
mean, it's fine. And I mean, I have my own mold story. So all of this is near and dear to my heart, as is the topic of adrenal burnout, because I've been there, done that when you have nothing left. And
you're like,
so,
yeah, you're on fumes,
yeah,
literally.
yeah.
Absolutely. And I would love if you don't mind later when we talk about if people have questions, even just sharing a little, if only if you want to, anything that you feel is appropriate, that you feel like you're comfortable to share about your journey, because so many people they feel like they're alone in this because not a lot of people are talking about it unless these, holistic functional type doctors are actually testing or talking about it. Excuse me. So I do think that the more that we share our stories,
Mhm.
I think it would be helpful for people to notice, okay, I'm not the only one who's going through this. And swapping stories can help people say, oh, okay, I didn't realize this symptom was linked to this, or I didn't realize this was linked to
Yeah.
this.
Yeah. And I mean, also the piece that it's not normal to feel bad all the time, no matter what stage of life that you're in. And that was sort of, I mean, finding the mold was like very affirming for me, and that I wasn't totally losing my mind.
Because
Because, yeah, I mean, just going to your regular doctor, they just kind of say, well, I mean, you've got two young kids, you're working,
tired.
you're moving. All of this is very normal, but it's not normal to have like no cup, like your cup is totally empty all the time. So,
They always blame it on being a mom, and while being a mom is exhausting, there's usually something else. So
yeah.
I wish you would go that extra level. So thank you for sharing that. And people ask all the time because they don't know what exactly burnout is. And it's basically, we just say it's a syndrome caused by prolonged stressor to something. And so they used to say it was mostly workplace stress. But now we're realizing that there's so many other areas to be exposed to prolonged stress, whether it be a physical stressor or an emotional stressor. And so burnout can look differently to everybody, right? Someone can be super, what they call energized, but they're just running on adrenaline and anxiety, but that might be their burnout. Versus someone else may be that they are absolutely exhausted, they can't get out of bed. But what the common thing I see besides, fatigue is of course one of the most prominent things we do see. but it's deeper than just a fatigue. There's usually a mood component to it,
Mm-hmm.
right? There's this feeling of apathy, not motivated,
Mm-hmm.
not inspired anymore. People feel like, things that they used. It's almost similar to depression in the sense of, you don't have that feeling or less for life, or like things that you used to be able to be happy about or even find enjoyment in. You're not finding enjoyment anymore in those things. So it can with the depression. So they call it a syndrome because it can not only affect you physically, but it can also affect you emotionally.
Mm-hmm.
So some of the symptoms that I see the most in patients with burnout physically, right? Because it's not just being tired, right? So of course it could be this exhaustion, but also pain, any type of pain, especially even musculoskeletal pain. People can have issues with their sleep and insomnia, right? Because of burnout. People can start having headaches, migraines, because they're wiped. I actually wrote a list so I didn't forget any. Also the fact that constantly getting sick. What did I just got sick and now I'm sick again. Or I got sick and now I'm sick for 3 weeks instead of being sick for maybe a few days.
So kind of
So
like a lack of
yes,
recovering. Okay.
like a lack of recovery. And we could talk about that too, about how the adrenals play into that lack of recovery, and also mycotoxin and mold illness. But feeling like you're sick all the time, the muscle pain, the neck pain, body pain, headaches, migraines, even heart palpitations, right? So you're thinking, oh, I'm having a heart attack. But no, it could, and they're actually, I found a bunch of studies just because I thought it was super interesting that they actually did studies on burnout with what physical symptoms. And so there was one in 2017 that said that people with burnout had a significant impact on higher risk of developing heart disease. And
Wow.
so they're saying that because of the high levels of the emotional exhaustion, as well as their blood pressure and inflammation being up, then of course it's affecting their cardiovascular health. So we think burnout, oh yeah, we're just tired, but look, it's affecting our cardiovascular health. It's affecting our heart health, which is super important. They even did one on burnout and immune function in 2005, and it basically said what we were just sharing, more susceptible
Mm-hmm.
to infections, as well, colds, flus, it could be any sort of infection, and then slower to recover. Then they also did a study in 2010 about burnout and sleep, like I mentioned before, which again can overlap with mold, because when
Right.
we have mold illness, we also can't sleep. And then burnout, they did a study in 2012 with gastrointestinal disorders. So IBS, I just have irritable bowel syndrome, right? Like that's just another syndrome of symptoms, but what's the cause, right? So irritable bowel, ulcers, acid reflux have been associated with burnout. And then musculoskeletal disorders, there's so many. Mortality, right? They found that burnout was associated with an increased risk of early mortality. So that's how much of the stress can do detrimental things to the body. And then, of course, like I mentioned before, then it has this emotional component, right? Whether it looks like someone having severe anxiety, or it's due to depression. It could be that lack of just kind of lust or apathy, or just feeling disassociated.
Mm-hmm.
So that's when we say, what is burnout? Now, everyone can, like we said, present completely differently. I actually just did a podcast the other day with Dr. Donnie. She came on my podcast, and she actually has a book called Stress Remedy. And she actually, in her book, talks about what burnout type are you. You do a little quiz, and it tells
Cool.
you. And then you
Yeah.
can find out if you want to do it yourself, DIY your health. You can then, look up. And of course, anything I shared today, I'm a doctor, but not your doctor. So
Yeah.
this is all, talk to your doctor about this. So is any questions you want me before I keep sharing some stuff? Is there anything you want me to answer questions at the end, or
We
just
had a question while you were talking that
Mhm.
was she was asking if when you're talking about being sick more often, if it meant just like a virus or just sort of like that underlying feeling of just like kind of being
Malaise?
malaise.
Yeah,
Yeah, like sick.
that's a great question. So it can absolutely be both of those. So you can be more susceptible to an actual virus, right? A cold virus, it could be a bacteria, right? It doesn't have to be a cold or flu. It could be a bacterial infection. You're more susceptible because your immune system is suppressed. And then you can also feel, what about those people who are like, I feel like I'm sick, but I'm not sick. Like
Right.
you feel like you have a fever, but you don't. But again, that kind of goes into that mold territory too, right? And that kind of even Lyme, you know, where you feel like you're sick or you have a fever,
Right.
and it's more like an autoimmune type process. It's at that feeling of malaise.
And like keeping in line with this, I wanted to sort of touch on too, like the inflammation piece, the inflammatory piece, because and I don't know if you want to talk about that after you get into cortisol, but there's also that um that sort of like that instead of having like acute inflammation, like when you get an injury or something, it's
Mm-hmm.
that like kind of constant underlying unrelenting inflammation that
Yes.
is just like it's it's very like it's kind of what led me to be like something is just not right here. It's just kind of like
Yeah.
it never
Yes.
lessens.
It never, right. And that's, so there's a few things with the inflammation component. So one, if we're under a state of burnout, right, prolonged stress, to like for what? It could be work, it could be family, it could be trauma, it could be taking care of a caregiver, right? What can happen is that then that state of being in that burnout can actually raise our HSCRP
Mhm.
levels. I actually did a reel on this, that there was a study that was done that your inflammation marker is actually raised, right? Then that same inflammation marker is one that we check for people's heart health too. So it's raising our inflammation levels. And then if you then add in, if you're in a state of, and we're going to talk about this in a minute, if you're in a state of where your adrenals are not producing enough cortisol because you're now at that level of such exhaustion, your adrenals are not even pumping any cortisol anymore, we're then not quelling that inflammation because cortisol is anti-inflammatory. So it could be twofold. Everyone thinks that cortisol is a bad guy, but
Yeah.
we need stress hormone, which I'm going to talk more about in a minute. So it could be that, and then you add on that if a person is exposed to mold or mycotoxins, then those in and of itself cause more inflammation. So there's just this constant fire that the body is under attack almost. And I hate to use that word under attack because then it's hard for us to heal if we think our body's attacking itself, but just thinking there's something that's, the better word is insulting. Like there's something that's underneath that's kind of fueling that fire.
Right.
Does
Okay.
that make sense?
Yeah. Well, I guess then now's a good time to talk about like what is
Mm-hmm.
cortisol, sort
Yep.
of the nice little dance that our bodies do to keep it balanced.
Mm-hmm.
Um,
Let
so
me just, did she say, I just want to see if this question was regarding what I asked. What can we do to heal and do nursing? Okay, I'll talk about some ways to heal at the end. And I definitely understand you being too sensitive to supplements. I've been sensitive my whole life, and every patient of mine is sensitive. So there are ways that you can support yourself. I'll talk about a little bit of those at the end. But our adrenal glands, everyone talks about adrenal fatigue, adrenal burnout. Our adrenal glands are glands right above our kidneys, okay? And these glands are responsible for producing hormones, one being cortisol, which is a stress hormone. People say, oh, stress hormone, I don't want to have that.
right.
Stress is bad. We have to have a certain amount of cortisol. And I always tell people, you want enough to wake you up out of bed, and then that slow decline throughout the rest of the day. So our adrenal glands will produce cortisol in the morning, afternoon, the morning, afternoon, evening, and then bedtime. So
Okay.
you can see someone's cortisol when you test them in this nice, they call it like a diurnal rhythm. So you want it higher here, and then it slowly goes down so that you can get to bed, because cortisol at night before bed is going to keep you wired and up, and it's going to keep you from falling asleep. So with one of those diurnal rhythms, you can then see, okay, does this person have too low cortisol, or does this person have too high
Mhm.
cortisol, or do they have a combo between both high and low cortisol throughout the day, and how can we fix that? So before we talk about how we can fix it, it's important to know what cortisol actually does for you. Now, if you don't have enough cortisol, let's say you are being exposed to a stress ongoing. You're in a relationship with someone who it's, let's say narcissist or abusive, or you have childhood trauma that you haven't handled or you haven't worked on. You have a chronic illness. You're in a workplace or corporate America and you're working. Eventually, after the adrenals are producing tons and tons of cortisol throughout the entire day because you're pumping, running from the bear, eventually they can't do that anymore.
Okay.
So that's why we call it adrenal fatigue or adrenal burnout. Someone asked, what's the difference between adrenal fatigue and burnout? Technically, they're controversial terms. They could say they're not true disease states, but we use it to categorize one of like what's more severe, right? So for example, someone who's going through burnout or adrenal burnout, it would just be at a severe state where it is at a point where their cortisol is now super, super low throughout the day versus someone maybe who had moderately low levels of cortisol. Does that make sense? So it's really important to know what it actually does. So tell me if you have any questions about that.
So like as it gets lower, does that increase your inflammation basically?
Yes.
Okay.
So cortisol is an anti-inflammatory hormone. So it basically, you need to have cortisol to quell inflammation.
Okay.
You don't want too much because too much stress hormone will make inflammation worse, but you also don't want to have too little. So cortisol will put the fire on that inflammation. So it's really important to work on your adrenal glands if you want to recover from burnout, and you want to see what your stress pattern is like. That's why we test for these things. But I want to make it really clear that there are really important things that the adrenals do and the cortisol does. So one thing is inflammation, healthy blood pressure response, also our energy levels, our hormones, our salt and water regulation happens with our adrenal glands, right? So if we're having these low levels of cortisol, we're not going to then have the support for all of these things and all of these systems in our body to work properly. So it's really important we have just enough, and it shouldn't be too high at any point of the day and too low at any point of the day. And some people actually have opposite circadian rhythms where instead of them waking up with high cortisol in a good way, a good, robust, not too high, they're waking up flat lines and then they're going to bed with it really high. So these are the tired and wired people that they're just waking up exhausted and they're going to bed like, what the heck, I feel like it's the morning. Why do I get this second wind?
Okay, well, that makes a lot of sense. And I mean, maybe we can probably go a little bit into sleep from there.
Yep.
Because, and I don't know if what I'm saying is correct, so definitely correct me if I'm wrong. But I've sort of learned or read that sort of melatonin is the opposite. Like the melatonin secretion that's supposed to happen is sort of like the opposite of the cortisol that wakes you up in the morning.
Yes.
Then melatonin is supposed to be what's occurring at night, and when that balance is completely off, it's like
that's 100% right. And then if we don't do things to get sunlight in our eyeballs during the day, and we're in front of these screens and blue light all day long, then at night that cortisol is going to go up and the melatonin is going to go down. So that's why they say if you wanted the best free way to start supporting your adrenal glands and recovering from burnout is going to sleep at a proper time, waking up and getting into actual sunlight. Even if it's a little foggy out, you still go out, and people are putting sunglasses on just way too much. They need to be getting their eye, because that is actually balancing their circadian rhythm. So that will help them with that melatonin and that cortisol throughout the day, for sure.
So is there sort of I shouldn't use this word, but I'm going to, prescription for sunlight exposure that you like to sort of give people for like sort of like your daily dose kind of a guideline?
That's a great question. So first thing in the morning, I tell people just like open up your blinds. If you can get out, if you have a patio, if you have a house, it depends. You know, some people are living in Manhattan, they can't run down. You know, some people don't have that access that quickly. But if they just open their blinds, they open the window, and they just immediately get sun. If they can go out, even that's even better. If they can go and put their feet on the ground, getting all those negative ions that will help ground them. If they wake up and their cortisol is really high, getting grounded and doing something like that and deep breathing. That really helps them to get that cortisol to come down. Does sunlight count if you have all windows and blinds open? I do think it counts, but I did see another doctor saying like you really, as much as possible, want to be like in nature. And they call it sun gazing. You don't want to be blasting, looking straight into a sun, gazing, not, blinding yourself.
Yeah.
But keeping your windows and door up, absolutely, of course, that's the bare bones, if that's what a person can do. But try to even like, I'll just open up my window so like I'm looking through the screen at least. Like I'm just trying to get as much light as possible. And you'll notice if you do that, you will feel a difference. You'll feel the difference even a half an hour later.
Yeah.
Right? Because then there's another cortisol secretion later. Right. So you could start feeling that. And I just tell people to get out as much as they can. I do have a lot of patients in Manhattan. They work in these buildings all day. Some of them are in like with no windows in their office. And I'm like, you just got to get up and get outside, even if it's for 5 minutes, move your body and get into the sunlight.
So like walk to lunch without your sunglasses on kind of thing.
Yeah,
okay.
Absolutely. Of course, if your doctor, if there's a reason that you should be wearing sunglasses for some reason, follow what your doctor says. But we're chronically wearing these sunglasses, and these sunglasses are stunting this light from getting in, and then telling our brain, okay, we need to start balancing that circadian rhythm.
Okay, that's really helpful. Okay, so I'll keep us going here. And I guess the next question for mostly for people tuning in from our page are, how are mold and burnout sort of related? And like piggybacking onto that, like how can having adrenal burnout make being exposed to mold and mycotoxins worse?
So that's a great question. So if you already are adrenal fatigue, so let's just say you have, which means your cortisol is low most of the day.
Right.
Remember we said that you need cortisol for inflammation, right? And so mycotoxins create inflammation. So now it's perpetuating that. So for any patient who has mold or Lyme, which I see a lot of these patients, and so does Dr. Sparks in my practice, we always give them adrenal support. And let's say someone can't afford one of the tests. Let's just say they're like, I want to get help and I can't afford one of these tests. They can just do adaptogenic herbs, which help your body adapt. So if your cortisol is too low, it'll go high, and then vice versa. So generally, the more data you have, the better, because then you can treat their specific circadian rhythm. But for example, if someone were to have low cortisol the whole day, it might be so low that I need to give them a glandular product or something strong. If I guessed and I didn't have a test and I gave them something stronger because I thought they had low cortisol and they had high cortisol, I'm making their cortisol even worse. So it's nice to, if you do not have a test, it's good to use adaptogens. So there's so many adaptogenic blends, supplements on Full Script, like that they have like rhodiola, holy basil, ashwagandha, eleuthero, things like this, milky oat seed. Those help your body. If it's high, the cortisol, it'll help it go lower, and if it's low, it goes higher. So number one is always supporting the adrenals, because if you don't have your adrenals, it's not going to quell that inflammation, and also your immune system is linked to your cortisol. So if you don't have enough cortisol, right, and you're in that adrenal burnout, and now your immune system is already suppressed from mycotoxins, now it's suppressed even more because of your adrenals. So they just perpetuate each other. And a lot of times the patients who have mold illness, they're super fatigued, which is another reason that people with, or another symptom of people who have burnout is they're super fatigued. And one of the questions was, that you sent me from, I think someone wrote in the box, and I just want to see. It was, hold on. Oh, why does mold make us feel so tired?
Yeah.
And it's because it affects, there's a few reasons. One, it affects our mitochondria, which is the ability to make ATP in our energy so we can feel vibrant and alive. And then also, think about the amount of toxins that have to be filtered now through the liver and the kidneys. So your
Mm-hmm.
organs are just on overtime trying to get all this stuff out of the body. And then again, it's affecting our sleep, then mold, right? So these all go hand in hand with the adrenals. So I personally, I'm not just one of those docs, or our practice is not just like, yeah, let's just take some binders. We're like, what
Yep.
does your body need for you to recover from this specifically? And so
Right.
working on that is, and again, this can be the opposite. You might not be in the place where you have low cortisol, you might have high cortisol all day. And then that's a problem too, because now that high cortisol is causing inflammation. So it's a very delicate balance between trying to help someone recover from mold and burnout, but it's almost like it's one and the same in my
Mm-hmm.
perspective.
Well, and I think it's also really important to talk about now how like both of these things deplete your body of like essential nutrients and minerals.
Hmm.
And when you're going straight to sort of like the bind excrete sort of methodology, sometimes your body is so depleted already, it's not ready for that. I mean,
Exactly.
I am a complete perfect example of that. I mean, it almost prescription binders almost made me completely crash and burn. So,
See, this happens to so many people. I have
yeah.
to tell you, I don't even I use them, I think, in 10% of cases. I don't even need to use them when you're working on those other things that you just said. Not always. Sometimes they're used therapeutically and they work amazing. But in your
Right.
case, so what happened when you used a binder? What were your symptoms?
Um, I just became I actually like during the mold exposure, I was having to like really bad diarrhea. I mean, I hate to say
Mm-hmm.
this. I mean,
Yeah,
I couldn't hold on to
yeah.
anything. It was like my body couldn't hold on to nutrients like at all. And so I mean, it was kind of like I was almost had like the muscle wasting and all of that type of thing.
Mm-hmm.
And then the binders, it was like I instantly bound me up.
Yeah,
So because
exactly.
my body was trying so hard to get rid of everything that just caused an enormous problem.
Mm-hmm.
And then my mineral levels were so low anyway when I began that it was just sort of the perfect storm. So, you know, thankfully I just kind of quit on my own and recognized that until I could get in to see somebody who did a little bit more like personalized
Right.
testing,
Instead
kind of more
of just having you take a,
yeah,
sorry, so quick.
like
Yeah,
the like more precision medicine, you know,
exactly.
as opposed to like a protocol.
Yeah,
Um,
because people are using protocols because, some people, they're like, they don't know the right doctor to go to, or they don't know that this stuff exists maybe, or they've been to the conventional doctor. They don't even know. I mean, they're not even bringing
yeah,
this type of stuff up. So everyone now on social media is talking about binders, and they're like, oh, I need that. And what if they're constipated already?
right.
So,
Well, and like for me now, binders are very helpful in the sense
mhm,
that like
mhm.
if I go to a bad hotel or something and I have
Yeah.
an exposure, I can utilize them now because I'm healthy. And they do really
Oh,
help me now.
yeah,
But
absolutely.
but
Therapeutically, they're helping you, using them when you need them. I think the problem is people are using them as their first line before they even are working on cleaning up their environment, eating healthier, sleeping. They're not going to the bathroom, they're not eating healthy, and then they just take a binder. Right now, that would be a perfect time for you, right? I just went, I got exposed. Or let's just say you're working with a patient and now they did these foundational steps. Okay, now is the time for a binder, right?
Right.
It just depends on where they are and how sensitive they are. Some people react wonderfully to them, and some people, they react really poorly because it's done at the wrong time or in too high doses, or they're already constipated and it's binding them up even more. They're not getting toxins out.
Yeah. Well, okay, so I guess we can, so how, when you're seeing patients, how do you test? And do you always couple testing for mold with kind of like the adrenal test, or do you only do that once you get the clues that it might be a
Yeah,
problem?
that's a great question. So to answer that, if let's just say I have a new patient, of course I'm getting an hour history of them. I'm like, okay, it sounds like they might have this. They're really exhausted. They're not sleeping, or they're dizzy, or they're having all the adrenal type symptoms. And then I'm like, oh, kind of there's a little mold in there. I would say probably almost 100% of the time, every single patient, I'm in the blood work, I check mold markers from the beginning. I don't care what your symptom is.
Hmm.
I always check. So there are markers in the blood. I check complement 4A is helpful. That can also be a marker for Lyme. So you have to know, it could be, so a lot of my patients have both, and some of them, I don't think they have Lyme, they just have mold. So you just have to discern what you think
Yeah.
that level is telling you. I check MMP9, which is another immune marker. I check TGF beta,
Okay.
transgrowth factor beta. If those levels are high, which in probably 50% of my patients they are, then I say I need you to test with a microbalance test kit to see where this is coming from.
Okay.
So then I have them go and do your testing, and probably 9 times out of 10, they come back with these scary looking dishes of
Yeah.
4 million colonies, and then I end up sending them to you, asking you questions. And I also then say, hey, your adrenal health is really important here. If they have the means, then I would do a Dutch test that does sex hormones and adrenals together. So then I get the whole picture. A lot of patients, they come to a naturopath, so they're like, hey, I want all these tests, and not everyone can afford all these outside tests. So I may just start with blood work, and I
Okay.
may do just all the basics, but it's really important to know that cortisol is not really the most accurate to check in your blood work, because you're only checking one
Hmm.
reading. Cortisol should be checked either in saliva, urine, over a span of the day. So either it's a saliva little swab in your mouth 4 times a day, or if it's a urine sample 4 times a day, because you don't know if that one sample you were fine at that time, but what about the other 3 times of the
Right.
day?
Right.
So you
Sort of like mold testing.
exactly,
You
exactly.
need to do it, in multiple
In
locations, multiple times.
multiple
Yeah.
exactly, because you just don't know. So I will tell them, like, if they want to, well, so this is another thing too I see all the time. The mold patients and the hormonal dysfunction I see from that, because of that HPA access, the
Hmm.
brain to that adrenal access. So they call it HPA, hypothalamus pituitary adrenal access. It affects us so bad, and then that affects our hormones. So a lot of these patients are having hormones, low estrogen at young ages,
Hmm.
because of mycotoxins. Sometimes they're just all over the place, their hormones. So I do like the Dutch test because it does sex hormones and it does adrenals. It shows your cortisol 4 times a day. And they have oxidative stress markers now, which we know mold can drive up. And a lot of the Dutch doctors I talk to, they'll look at the test and they'll say, oh, this person might have mold, or
Right.
this person might have, because there's certain patterns that we can
Hmm.
see, deficiency patterns. So there's a lot that we can do in all of those tests. It just depends on what the patient can do.
And this is just a question that I was thinking of, but I mean, do you feel like you're seeing more mold now than you used to, or do you just feel like you know to look for it now?
Both.
Okay.
Because when I was in school, I graduated, I think 2015. We didn't talk about, I don't remember talking about this much at all. And
Hmm.
then once because I was diagnosed with Lyme. Then I had to go down the rabbit hole, as you know,
Yeah.
of that whole mold world.
Hmm.
Then I started learning because then I got exposed to mold. Then I started learning it. So I think the more that I learned, the more that I checked. But I
Hmm.
also think I am seeing it more lately. I don't know if it's because I don't know if it's because the people who I have who've had mold are now telling people that they think have mold, and that's why I'm
Yeah.
seeing
Yeah.
more of it,
Yeah.
right? But I definitely think because I've learned more, now I know, oh wow, I didn't even think that symptom could have been connected to, 10 years ago when I was
Yeah.
doing this.
I mean, just from the microbalance sort of standpoint, like we get a lot of customers who they just find us on their own because they've tried everything and they're just not getting better. They've been to a million different
Mhm.
doctors, they're just not getting better. And they're like, my house smells musty. Maybe maybe that's why. And that's kind of how they start sort of digging and trying to figure it out. So,
Yeah, they thought it was normal, right?
right.
Like, oh, well, that's just, I go down my basement and it's just musty. I think, people just think, I don't think average people, I wouldn't have probably known this 15 years ago. They just like, oh yeah, it's mildew. Like, oh, it's just mildew. Oh, it's just a little
Right.
water. Really, um, no one was really paying super attention to it and being like, oh, hey, this can make me sick.
Yeah. And I mean, we could probably go down the rabbit hole all day about, is it because, there's more mold, or is it because people are at home more, or that we're
That's
just
true.
not as healthy in general,
I
kind of
think
all
it's the
those
not
things.
as healthy.
Yeah.
I think it's
And
even
we can't, like, our bodies just can't, like, take it like they used to be able to. I mean, I think you're
yeah,
probably, yeah.
right? Like if you're we call it our soil, our environment, our terrain. If the terrain is off, it could be, I think of any toxin.
Hmm.
It's really any toxin that we're trying. Yeah, think about it. If we need to get heavy metals out of the body, we're not going to do so efficiently if we're in a sick state. Most of the patients that come to me, they're working so long, they're skipping meals, they're not moving, they're really not taking many nutrients, and so that's what, to answer the question of like how do you kind of start. It doesn't sound fancy, but the most basic foundations are where people need to start: breathing, stress management, sleeping, drinking half their body weight in ounces of water, right?
Right.
I'd say probably 10% of my patients are drinking water. Just them drinking water moves their needle,
Hmm.
right? Doing all of those things first instead of going to fancy supplements and,
Okay.
all these fancy things.
Okay. Well, that's really helpful because I know a lot of people that are joining are doing so because they're trying to, take control of their health and they may not have the
Exactly.
resources, yeah, to
Yeah.
sort of do everything.
Yeah.
So,
That's why if someone's in a situation where they're like, I can't see a naturopath right now, I can't afford this testing, that doesn't mean you're hopeless. There's the biggest, I remember my mentor used to always say, when we were very nervous and we got out of school and we were just coming out, we were baby docs and we're like, oh my god, we're gonna help these sick people. He's like, half people are dehydrated and they eat crap all day. They give the body what it needs and help take out what it doesn't, or the garbage, right? So
right.
just you eating clean and moving your body and sweating and just making sure you're getting proper sleep, your body will start to detox naturally. You don't need fancy things to start opening up your own bodies. Yes, of course, we've now been in situations where we're in prolonged levels of toxins, or we've done this so long. That's where supplements come in. That's where a naturopath would have to say, okay, we need to do this, this, and this. But everyone needs that foundation first. And then if the person, let's just say, does all those things and they can't afford a test, try they could try like an ashwagandha, even if this is like ashwagandha, right? Like that can help cortisol if it's too high or too low, and that could just support their stress, right?
Yeah.
That could support their stress, and that's it. Like that might move the needle huge
And
for them.
it's really important too, like with you saying that, and it made me think of this.
Mhm.
Herbs are a cool place to start because your body, I mean, we've had them for so long, our bodies are wise to them and they sort of like use them how the however your
Yep.
body needs to
Yep.
use them,
Exactly.
rather than like, something synthetic or,
Yep.
made in a lab. Your body can like use its intelligence to kind of use it the way it needs to be used.
Exactly. And then you just see if am I on any medications and is there just the only thing with herbs, 100% what you said. The only concern with certain herbs is okay, don't start taking things if you're on a bunch of medications and you don't know what's interacting, right? So
That's
some
a
herbs,
great point. Yeah.
right? Because people are on, because of their burnout and they don't know where to turn. They're
Hmm.
on antidepressants, they're on benzodiazepines, Xanax, they're on all these things, and then they're like, oh, I'm going to take, this tea at night. But then that tea might have something that can increase their serotonin, and
Yeah.
right, that may be dangerous, right? So if you're on a medication, always just be sure to check interactions, ask your doctor. You could just call the pharmacy; it's free. You could literally just call the pharmacy and say, "Hey, does this interact with my medication?" And usually they can tell you, does it potentiate the effect? Does it have no effect on it? But absolutely, with herbal adaptogens, at least, they're exactly what you said. Your body can kind of like it does what it needs to do with them. But if you're sensitive or you have an income limit of certain amount, you can start with one thing, right? An
Hmm.
ashwagandha tea. There's little things that people can do. It always doesn't always have to be the most complicated. Yeah, some people do need complicated protocols and
Right.
stuff, but it always starts with those basics and foundations, regardless.
Okay. Well, and I want to tell everyone who's tuned in, like if you want to sort of get more in depth, Dr. Sue, she wrote an article for us on sinusitis wellness, and
Oh
we
yeah,
can, when we post the video, I'll post the link to the article about adrenals so they can
perfect.
reference that if they need to.
Yeah, that would
Um,
be perfect.
and then we'll try to get finished up by like getting through a lot of these
Yeah.
questions.
The,
Um, let's see what we haven't addressed. What is the difference between adrenal fatigue and adrenal burnout? Is there a difference?
Yeah, so what I would say, yeah, before I mentioned a little bit about that, it's a controversial to really even have those terms because they say, oh, it's not a real medical diagnosis. It's just the severity. It's just basically like, am I at a point where I literally have extreme low cortisol
Mhm.
versus am I at a place where I have moderately
Okay.
low levels of cortisol? So it's just kind of like it's basically like a trajectory of how bad is it.
Now, is there a point where this becomes like medically dangerous to
What
to be
to be low cortisol?
so burned out? Yeah.
Yeah, absolutely. So, like if anyone wants to hear it too, if they do listen to this video, in the beginning, I did share there was one, two, three, four, five, six, seven, eight, nine studies of what burnout can do to your heart, your mortality, your immune system, your musculoskeletal system. So some people, there are people who develop something called Addison's, which is that's when their body's not producing cortisol anymore.
Right.
But that's like I've only had one patient who actually had Addison's disease. But yes, if your adrenals are barely producing cortisol, our immune system's not going to work. You're not going to be quelling that inflammation. Your blood pressure, nothing is going to be managed in a proper way. Usually those people feel pretty awful.
Okay.
And if they don't, it might just be their adrenaline kicking in that acute, right,
Okay.
times of the day when they feel like they're running from the
Okay.
bear.
Okay. And then our next question is, if I do have mold in my home, how do I begin to detox? And can I if I'm still in mold?
So the answer to that question, and this might be controversial, but I have quite a few patients who cannot leave
Mhm.
their home and they've gotten I have at least probably 5 to 10 people in this last 6 months that have gotten at least 60 to 70% better or more living in their
Mhm.
home. That's not everybody. And I
Right.
see that because not everyone can leave their house. So what do you do? So first I tell them to wipe down their whole house with the microbalance wipes. Then I tell them about the candles, so your mold candles. Then I tell them to get a good air filter. So I like Do you guys have one that you guys?
I mean, we have a couple. I mean, there's some really good ones. I just, I mean, I think the main thing people need to understand is, filters can only pick up what's actually in the air.
Right.
So, if it's behind a wall or something, they may lessen your exposure from a breathing perspective, but you still eventually are going to have to get it fixed.
Yep.
Like you can't but
Yep.
100% a really good air filter in the rooms where you spend the most time will help you, and you will notice a difference. I mean,
Yeah.
that's what I think.
I agree. I tell everyone to use, and this is my personal opinion, I tell people to use the Air Doctor. I don't know, are we allowed to say certain
Oh
brands?
yeah,
Yeah.
yeah. I mean,
Okay. Okay.
anything
Yeah.
you find helpful, I
Yeah.
want you to share. Yeah.
Okay, good. Because I originally had an IQ Air, but that one's extremely expensive, and not
Mhm.
everyone can afford that. And then when I found the the Air Doctor, it's more affordable for people. They can buy smaller units to put, and I feel that the patients who have had mold exposure, I feel like if they didn't have that, that probably would have not moved their needle as quickly. Is that the only thing that helped? I just think it's a kind of in the foundational things like the wipe down, the candles, obviously trying to fix what's had water damage. Of course, you want to fix it, and then oh, if I also have, I think they give you like, I don't know the percentage off, but I have a discount code for Air Doctor. It's Naturally Sue. And also for your products too is Naturally Sue.
Yep.
So any of those products. So cleaning up the environment to detox yourself from mold, supporting the body with antioxidants, right? Any type of foods that are high in antioxidants, polyphenols are really important. So think of like the dark green vegetables or dark pigmented fruits and vegetables. Fish oils are really good. Any type of really good omega-3 fatty acids are great. And then, of course, detox with certain glutathiones, maybe certain binders. Again, it really depends on the patient. Making sure that they're going to the bathroom before you
Mhm.
start to dump a bunch of stuff out of their system. So I did write an article on my website. Actually, Dr. Sparks wrote an article on my website, naturallysue.com, on how to detox mold.
Mhm.
So we talk about that. So if you want, we talk about products that we like. So if you go to naturallysue.com, or you just put in how to detox mold, Naturally Sue, it should come
Okay.
up right away. So that is a whole article going down how you could start detoxing. And
Okay.
then also sweating. And if you don't have a fancy sauna, you could put on a sweatshirt and go out for a walk,
Right.
or through sweatshirts and start sweating. Right? Sweating is a huge way to start getting toxins out. So I would say those are my top. And then you guys can read the article for any other supplements that I like.
Okay. Well, and also speaking of exercise, do you have any tips for people that are experiencing burnout to either like exercise tips? Because I know a lot of, so there's sort of the both sides of the coin. There are the people that are the like hit exercisers, and um they are like they like that high intensity, and there are a lot of the burnout people as well. And then there are the people who have been feeling so tired for so long, the thought of working out is just like
Oh God,
no.
don't.
Yeah.
Yeah, yeah.
So
And then you should never be doing high intensity exercise if your cortisol is already high, because exercise acutely raises cortisol. That's what helps you move. That's what makes you go. But if your cortisol is already high, you're putting yourself into even more hypercortisol. And then if you don't have any cortisol, you shouldn't also be doing intense exercise because you don't even have enough cortisol, right, to be able to
okay.
kind of surmount that response. So if you're really, really low cortisol and you test, I would not do high intensity. And if you're really high, I wouldn't do. If you are at a good cortisol throughout the day, great, do your high intensity. And then I would say for patients who are generally sick, mold, burnt out, doing that rigorous exercise is usually makes them 10 times worse.
Okay.
So Pilates, yoga, walking. Walking is underrated. Few pound weights, like walk. Just go out and walk for an hour.
Yeah.
Just walk 30 minutes. If you're so exhausted because you're so sick, all you can walk is 10 minutes, walk 10 minutes. If you can only walk 3 minutes, 3 minutes, and then aim up to 10 minutes. So walking, huge. And I would say for anyone chronically sick, mold, Lyme, just moving the body more than anything.
So does movement help? I mean, I know it helps with lymph and detoxification, but does it directly, I mean, other than, are there things like weightlifting or anything like that that are beneficial for
Yeah,
cortisol?
absolutely. Because just for our muscles,
Okay.
right? So, and our metabolism and our blood sugar regulation, which of course the adrenals have a impact on. So, absolutely, if you can start by walking and then you can start doing small weights. You don't have to go straight to Orange Theory or CrossFit, right? You can even use your own weight, right? In between meetings, you could do some squats. You could do like presses on the wall, right? Start building your own muscle. But absolutely, because the muscle is what's going to help you recover from things quicker.
Okay. That's really important. Okay. And then so our last question is, how do you manage stress from mold illness to avoid burnout while keeping your job?
Yeah.
That's a big one.
I would say adrenal support, like beside
Okay.
the basics, like get on an adrenal support.
Okay.
And if you don't start with adaptogens, I think if starting with supporting your adrenals, and what do the adrenals love? They love sleep. They love getting to bed before, like, or not later than 10, 11 o'clock. They like vitamin C. They like B vitamins. The adrenals love when you are properly nourished with mineral rich salts. So many people are low in sodium every time I test them. They're like, oh, yeah, my doctor said to watch my salt. And then they're dizzy and exhausted.
Okay.
Getting a good mineral rich, I love the Redmond's sea salt, right? It's just, or the Relight electrolytes, or even if you just little salts in the morning in their water, they could put, or the electrolytes. That would help people. Their adrenals usually crave that if their cortisol is low.
Okay. And I mean, I know a lot of mold people that are suffering with mold illness also have the frequent
Yeah.
urination. So is in terms of that, is electrolyte supplementation helpful or
Yeah.
not?
Yes.
Okay.
It is helpful, but if you have mold you're exposed to and it's messing with, so mold messes with your anti-diuretic hormone. So that
Hmm.
hormone basically tells you to stop peeing, basically. So if you're exposed to mold, that anti-diuretic hormone, which says to stop going, is not working. So you're just going constantly. And so I see these people, I have this two patients, every time I test them, they're dehydrated. And they're like, but I drink half my, they're like, I promise you I drink half my body weight in ounces. But I think because they're going so much, they're just peeing out all their electrolytes. So you need electrolytes for the adrenals. You need it. You need that salt, and you do need it if you're going constantly peeing and you're going to the bathroom and going and going and going. But of course, what's the root cause? If you're going a lot like that because you have mold, then you have to fix your mold problem.
Right.
But in
Okay.
the meantime, you have to also fix now your electrolytes being too low.
Yeah. Yeah. I mean, we get a lot of questions that are, it's so frustrating when you're peeing all the time, and then the knee-jerk reaction is to drink less
Less
because you
water.
you don't want to
Yeah.
be peeing all the
Yeah.
time. And so it's sort of like, I mean, I'm obviously not a doctor and I never know what to say. I mean, while it seems like it would make sense, I know the opposite is true. Yeah.
I tell people, I don't know what to tell you. When they tell me that,
Yeah.
I'm like, I don't tell you. You have to go to the bathroom. Like, it is what it is.
Right.
Because you're not drinking water. You're dehydrated. Now you're not even able to get toxins out properly. So now it's concentrated, right? And then that dehydration is causing more fatigue. So people don't realize the most common symptoms of dehydration: fatigue, brain fog, dizziness, constipation, and anxiety. Think about how many people have those symptoms. They're just dehydrated. So I just tell them, I don't know what to tell you. When they say I can't pee a lot, I'm like, yes, you have to. Because what you have to. You can't stop going to the bathroom because you're afraid you're going to go too much. Because now
Right.
you're perpetuating the issue. You can't even get stuff out, and you're actually making yourself feel worse because you're dehydrated and now you don't have enough electrolytes and minerals.
Yeah. So, I mean, also, I guess moral of the story is if you're peeing all the time, you might want to look too.
Yeah. If you're peeing all the time, especially at night. So like when I hear people go to the bathroom all the time, I think, okay, what's your blood sugar like? Do you have
Right.
diabetes? What's your nervous system like? Do you have, are you anxious? Because people who are anxious, PTSD, they're peeing all the time too. And then people who have mold, they're going constantly. So those are the top ones I see. But again, there's more, but those are the top ones I see with going to the bathroom all of the time. So there's something that's off. I see it in a lot of anxiety patients too, but again, then a lot of these mycotoxin illness patients also have anxiety. So a lot of these things overlap.
Hmm. Well, and piggybacking on this last question, so are there any like adaptogens or supplements that you gravitate towards for people with mold
Mhm.
that are different from like the normal things you tell people who are having cortisol issues or
So
burnout issues?
one of the ones I love, if someone doesn't have a Dutch test and they haven't tested, I will give them the Gaia HPA. They changed the name like three times. It drives me crazy. I think it was called daytime. I think it's called HPA daytime maintenance.
Mm-hmm.
It has nervines, which are herbs that support the nervous system, and adaptogen. It's a nervine and adaptogen support because some of my patients, they're exhausted, but they're also anxious. So if I give them too stimulating of adaptogens, sometimes people who take like rhodiola, it kind of revs them up a little bit. Sometimes if it's in a lower amount, it's enough. So there's certain adaptogens that can be a little bit more invigorating versus
Mm-hmm.
a bit more, or dosages of it that may be more invigorating. That is my blend for, I don't know what your cortisol is. I assume it's messed up,
Okay.
too high, too low. We don't have a test. You don't want to, you can't get the test, or you're in the middle of doing the test, or the test is, being processed, and we want to give you help in the meantime. I use that one. Then if I see somebody's level and they're super low, then I'll give them like combo glandular products. But I never say those because I don't want people to think what they have and then take those because they can make themselves significantly worse. So I would say the safest one when I don't have, again, if it doesn't interact with your medications and your doctor says it's okay, that happens to be one of my favorite ones
Okay.
for adrenal health. And I think there was something else a few people are nervous. What can they do to heal through nervous system and get? Okay, so are you asking, so she said, what can we do to heal? Is this the question you were looking at? I do nervous system regulation and get sunlight and ground, only drink water. I'm too sensitive to take supplements. Have you ever tried microdosing your supplements? So like getting herbals in tinctures and like taking a drop in a glass of water and taking a sip type of thing.
Oh,
And I
that's
know that
cool.
sounds like, well, what the hell is that going to do? When you're that sensitive, that does a lot. And I've done that
Hmm.
myself most of my life. I have very sensitive patients. So you can try microdosing things. You can do those with the drainers for mold. I do drainers all the time. You can even do that very slow. Some people even take the biotherapeutic. Have you heard of people when they say drainers and they're talking about like certain homeopathic combos to start draining their cells? Have you heard of that?
Yeah, yes, and we like one of sort of our homeopathics that a lot of like these people probably would benefit from is the CellTropin, and
Mm.
that's our pituitary and endocrine support
Oh,
product. But
is
what you're saying, so for our really sensitive people, you can just fill like a glass. It needs to be a glass. I
mm-hmm.
always tell people this because glass is really helpful for homeopathy, keeping all of the
Mm-hmm.
bioenergetic pieces of it. But fill a glass with warm water, and you can spray whatever the dose
Yeah,
is of the product into the warm water and let it kind of evaporate, and then just sip on it.
I love that. That's the best sensitive people, and that
Yeah.
moves needles for people.
Right. And you can take one sip, see how you do.
Mm-hmm.
And and it's a really easy way to work up like dosing wise as well. And if you're a fan of homeopathy, and this doesn't have anything to do with microbalance, but if you take, if you're into the like single supplement pellets, like the remedies, you can put any of those pellets in a glass of water and dissolve them and drink it throughout the day
Yep.
and get the same effects as you would from taking, just a dose. So that's a little tip.
Exactly. I'm
Yeah.
really happy you said that because that's what I call water dosing. So my really sensitive patients, I literally have them put one pellet in water and I have them take like one sip a day.
Hmm.
That's how sensitive some people could be that they need to take like I always say it's like sometimes you just need to press the elevator button once,
Hmm.
right? And that's all it needed for their body. And then they could start taking more of that
Right.
throughout. And one other thing I just saw someone asked is, to be honest, I do not know if there's testing for mitochondria. I don't know that. If you send me a message, I'll look into that for you. My Myco Lab blood testing. I heard of that lab. I just never used their blood testing. If you send me their panel, I'll look at it and I'll tell you what I think of it.
It's
Someone said,
yeah, I mean, I've heard a lot about it just from working with microbalance. I know it's basically like a blood mycotoxin test rather than the
oh, it is. Okay,
yeah.
that's awesome. So they can do this on their own or they have to have a doctor order it?
It depends on, I'm not really sure. It might depend on what state you're in. If it's a direct access testing state, which are
Okay, then they
most,
can maybe do
yeah,
that.
which are most
Okay.
states now. Like you could just go to a Quest and get a blood draw and then send it in.
Okay.
Um, they do have a website. I mean, I have no affiliation with them at all. But people can look it up. But the one and I know the one like sticking point for a lot of practitioners is that the blood indicators, you're not going to really know if it's current or like previous like you would
Right.
with urine. So there's that. But I mean, urine also poses the problem of like, sometimes levels climb, even when you're out of the mold because you're finally like
Because you're
getting rid of
kind of
it.
exactly,
Yeah.
and that we didn't even talk about just really quickly. You can do like, I'll do like mycotoxin urine tests from like Vibrant or Great Plains or
Mhm.
those tests, and exactly what you said. We don't know when someone has a really high level and they leave the mold. We're like, oh crap, is it in the new place or is it their old stuff? So it's
Yeah.
still hard to know, but I did ask. So Dr. Sparks is another doctor in my practice, and she actually got mold certified by Dr. Krista. I don't know if you know
Yeah.
Dr. Jill Krista is amazing. And she actually taught me that there are certain like when you do the tests, I think Vibrant tests for over 30 species. Great Plains is a little bit less than that. And she was saying, as I said to her, does it for people who can't afford mycotoxin testing, does it make sense for them to test if you're going to treat the same way? And she said, yeah, there's certain mycotoxins that need certain things or that affect a certain part of the
Mhm.
body, right? So, of course, more data is better, but it doesn't mean that you can't get well just because you didn't get mycotoxin. I mean, if you had mold in your house, you can assume you have mold. And
Yeah.
another thing I think that's important is we had someone once where they had nothing show up, and we were like, well, is their detox pathways off? We were so sure they had mold. So, it's never 100% with any test, but they're more of the specialized test if you're going to try to test for mold.
Yeah. Okay, well that's really helpful. I mean, you can always like do um I mean there is like the Emma combo test, which is like the environmental version of a mycotoxin test. So, and it is expensive. So, if money is a problem, it's probably not the test for you, but it would be a way to sort of have the urine test and the like home test, and what they have on them is it would if you've got the mycotoxins in the urine that are also in the home, then
Right.
kind of a bingo.
Right.
But
That's what you said is available. It's available through your website, but you guys are not the lab, right? Or you just
no.
refer to them.
Yeah,
You refer to them.
we just offer it as sort of a value add to people that if
Okay.
they want to go deeper and do something that is like more in line with the lab testing they're
Mhm.
doing, that would be the next step. And then, and it's the cool thing about it is it's directly testing for mycotoxins. So it's what is kind of saying what is your risk of exposure in that place.
Mhm.
So, it kind of can help you understand, like how seriously you need to take the problem.
Right, right,
Yeah.
right. That's a really good idea. I have to look more into that test because I didn't actually know you guys had that until the last time I talked to you.
Yeah. I mean, anyone, it's real time lab. You can get it directly from the
You guys
lab. You can buy it from us.
them.
It's the
Hmm.
same price. It doesn't really matter. But, if you are to the point where you're like, should I stay or should I go? That's when it might, or, that's when it may be very valuable, because if
Okay, that makes
your
sense.
level of exposure is very high and you've got neurological
Right.
symptoms, you probably need to get out of there,
Yeah.
because that's pretty
Hmm.
serious. So, um,
Absolutely.
but I mean, in most cases, there are things you can do to fix it. We have fixed my home and it is safe and I am living here and I am well.
I
So
love it.
yeah, I mean, it can be done. You can heal. And so, I don't want people to
Yes.
think that that's,
Yeah, absolutely. And I see people healing all the time. And even I love that you guys have the fogger. I just used mine last night. I think it was I texted you. I was like, how much water per solution do you put in there? Because I lost the pamphlet. I was like, all right, it's time to fog. So I love that you guys have that fogger with the solution. That's great in case you're moving and you want to, if you want to move and keep some of your stuff. Or I think it was you who were saying you just use it if you're not feeling. Was it you or I don't know if it was. I don't remember which one of you told me that when you're not feeling well, you're like, oh, it's time to fog.
yeah.
Right? Things can be starting to build up
Yeah.
with mycotoxins.
I mean, my husband is like the traveling fogger. He like last weekend went to a friend's house and they had just moved in and fogged because they thought it was smelling like dogs or something. And I mean, it helps with odors
Oh,
too. So
I was
there's
going to
that.
ask you, does it, besides from getting mycotoxins, besides from getting mycotoxins out, can it also like, I got a new area rug, right? Because I wanted to get rid of, right? And I fogged probably like 3 times, vacuumed, like you said, fogged it. Does it also get rid of other organisms, or is it just mold that the fogger can get rid of?
Well, I mean, obviously, we can't like say that it kills
Yeah,
things
yeah,
because we haven't
okay.
tested for it. But I mean, anyone can look up extracts that are the citrus seed extracts we use, which are lemon, lime, tangerine, and grapefruit seed.
Those
So
do
they're
have
all, yeah,
antimicrobial properties. Oh, I see. That.
they're antiviral, antifungal, anti-parasitic. So
That's
I
awesome.
mean, yeah. So with very little dwell time and no VOCs or
Yeah.
anything. So,
Oh, I love it. Love it, love it, love it, love it.
and somebody was asking like what testing we were talking about. And I think we were talking about, Dr. Sue was talking about, like urine mycotoxin testing from Vibrant and Great Plains. And then we were also talking about the Emma, it's called the Emma combo and it's, real time lab. You can look it up on their website and we have it on the Microbalance website too, if you already know where that is. So either way.
Yeah, exactly. And then we talked about some blood testing like C4A, TGF beta, MMP9 to do in blood to check for immune responses to mold too.
Okay. Is that part of the Dutch
No,
test that you were talking about?
that I
Okay.
do. That's in blood
Okay.
work. That's just urine.
Okay.
Yeah.
Okay. Sorry.
No, no, that's okay. There's a million. Listen, it took me. I mean, it's like one's urine, one could be urine and saliva, one's blood. Most people don't know until we tell them what we have to do because every test has a different way to test it.
Okay. And somebody asked if any of this would show up on just your regular blood, like if you went to the doctor and they took your, I think it's like a CB, the whatever.
CBC?
Yeah. Would any of this, I don't think so. Am I right about that? Okay. I didn't
There's
think
a
so.
CBC is a complete blood count. It's only testing your white blood cells, red blood cells, hematocrit, hemoglobin, lymphocytes, platelets. However, you might have low white blood cells, low platelets, some low levels of certain things because maybe your immune system's been taxed from mold, but it could be a million other things that are like that. You could have just been sick with the flu. We can't 100% tell. We can't tell in a CBC if you have mold. It could be a puzzle piece,
Okay.
but it's not definitive enough whatsoever.
Okay.
And Maria, you can send, if you have questions for any type of test, you could just send me a DM and I can send you any links too. And I'll send out too once we have the recording, I'll send out a newsletter too. So if you join Microbalance's newsletter, and then also my newsletter, all you have to do is go to naturallysue.com and it should pop up and you put your email. I'm going to put this and I'll put the mold, how to detox from mold. I'll put the burnout article
Okay.
about mold and burnout. So I can send all of that information in one newsletter.
Okay. And I'll and when we post the video, I'll try to remember all of the things that we talked about and put links in the post. I mean, you'll have to copy and paste them, but they'll be there.
Yeah, perfect. And someone said I have low white blood cells. Yeah, low white blood cells. So I personally had low white blood cells for years, right? But I also had Lyme for years and I didn't know about it, right? So it could be low white blood cells could be so many things. It could be environmental toxins you were exposed to. It could be something more serious. You know, if it was ongoing, sometimes there has to be a further workup done. Sometimes it could just be that it was you were sick, right? Or every time you got tested, you were sick. So there could be a lot of different reasons for low white blood cells. Can mold illness cause pale face and dark under eyes? Yeah, parasites can cause that too. Mold, I've seen any toxins that has inundated your body, you're going to look kind of pale and tired and exhausted, and your cortisol's low and you're just kind of worn out. Absolutely. And Shoemaker panel, yeah, so Shoemaker, he's the one who talks about doing the C4A, the TGF beta, the MMP9, the MSH, but I have to see what else he checks in there. But Richie Shoemaker, he's awesome.
Yeah, and he's got like he has a website too, and he lists the things he lists all of the testing he typically does. So if you, I mean, I think you could probably just Google Richie Shoemaker and
you'll
find
see
that.
his test.
Yeah.
Yep, absolutely. I think that was all the questions, right?
I think we hit them all.
Perfect. This is so good. We have so much good info in here that I think I answered. Yeah, I looked at the questions you asked me or before that people asked in your little question box. So we got all those.
Okay. Well, I mean, if anyone has any other questions, post them real quick, or we'll close out for this time. And oh,
how I feel and look. So it's hard to answer that because I don't have a history. I'm not your doctor, but if you're feeling like you have, I mean, it could be so many things, right? You could be iron deficient anemic. Like it might have nothing to do with mold. It could be your thyroid might be off. It could be you have a parasite. It could be a stool test. So it really just depends. I would just make sure that you're at least getting checked your basic vitamins and nutrients. Are they low? And then if you have GI symptoms, could I have a parasite? Low, also dark under eye circles can be allergies too, food allergies, gut issues, environmental allergies. And then say I'm Dr. Susan. Yes, I will respond, Maria. Yes. Is that helpful? Okay.
and I mean, if you have any product questions or anything like that, you can always DM us and we'll respond to.
Yeah, they're so good. If you guys have questions about what to use for your house, like the fogger, they're amazing. So just write to them on Instagram and they'll get back to you with any product suggestions. I have probably an entire cabinet of your product. Oh, by the way, and I've been meaning to do a video. We tried my fiance tried the sleep, the Z, what is it called again?
It's called Ahh Sleep. Like yeah.
Sleep. Okay, that one. Well, just so you know, the bottle is absolutely empty.
Okay.
So I hear like in the middle of the night. And I'm like, what is that sound? And I just hear him putting it in his mouth. So he really likes it. And it says it's helping him. And if he wakes up in the middle of the night, it helps him go back to sleep.
Yeah, I love it. I mean, it works for me. I mean, I know not everything works for everybody, but
Mhm.
if you do well with homeopathy and you have trouble with sleep, it might be worth a try.
Yeah,
So,
it's awesome. It's of course, and work on your cause, but it's absolutely amazing. If stress, you for sure. And then just a few other last quick questions. How much is mold testing? So you could do some blood markers through insurance that those can cover, like C4A, I get covered, TGF beta, those like blood markers can get covered, and then the mold test can go anywhere from $300 to $500 out of pocket. People can use FSA or HSA for those. What about low body temperature? I mean, low body temperature can also be your thyroid being off. And then could mold be causing your thyroid to be off? Because that's, yes, right?
yeah.
That's another. I see a lot of patients with mold illness that affects their thyroid. So that could be, again, there's so many causes to some of these. I have a lot of questions for mold, especially after flooding in our house. Yeah, so that's probably, I would definitely do the test kits. They're $36. They're the test kits, and at least you can see how high the mold is, and then obviously have to get the flooding taken care of. And
Yeah. And Marianne, we just published a video on our YouTube that was like in direct kind of response to all the flooding and storms that just happened. And it literally gives you
oh,
kind of a step by step. I mean, it's not really about microbalance. It's just about like just kind of how to get started on cleaning up. It kind of just gives you a little bit of a roadmap to make it not so overwhelming. So you might find that helpful. And if that's not what you need, just DM us and we'll help. Like that's we love helping. So
guys,
please
they're
just send us a
so
message.
helpful. You're so
Yeah.
helpful.
Well, think we're good for tonight. And thank you so much for coming on and
You're
giving us
so
your time.
welcome. Of course.
Um,
Thank you for having me. Thank you for, like I said earlier, you've been amazing support to my practice to help patients. So thank you so much. I so
oh,
appreciate it.
no problem. And thanks for joining us. And if you liked it, let us know. And hopefully we'll have more of these in the future.
Perfect. Thank you guys. Have a great
Bye.
night.
Bye.
Bye.